All right, we should be going live any second now. Let's see how many people are joining us. And yep, we're starting to get there. The numbers are coming in. Hey guys, welcome to our recap of the 2021 State of Addiction Treatment. I'm Glenn Hadley. I'm your host today, and just really excited to have you all here. I'm going to give it just a little bit of time as people trickle in, so we don't get started and y'all miss any information. We have a wonderful slew of panelists today that contributed to the original report, and really excited to have them back and joining us to not only recap what they stated earlier in the year, but maybe expand on it and see where we're at now. So I do want to do a little bit of housekeeping as we get started today. So if you're joining us and you have any tech support issues, you can put those in the chat. Go to the chat feature. And we have Dave from Dreamscape is behind the scenes, and he's going to be answering all of your tech support questions. If you're having any problems with your audio or video, or you lost your keys or something like that, put that in the chat, and Dave will help you out with all of those things, including finding keys. He's hating me right now for saying that, but he'll help you out with that. If you have any questions for the presenters, you can put that in the Q&A section. Okay. We have that set aside over there, and we'll be going through those and monitoring those throughout the session. And I'll be asking questions from there of the presenters. So feel free to put those questions in the Q&A for the speakers. Also, what I'd really like to do, and I've had a lot of fun with this over the last years, is please put where you're watching from in the chat. We want to see that. We want to see who's logged in, who's watching the webinar today, and where you're watching from. So go ahead and put that in the chat. So any tech support in the chat, and where you're watching from in the chat. Let's see if there's anything else. I think that's all. Look at this. This is awesome. I love it. We got people logging in from all over the country. Really excited to have you guys here. Come on, it's good stuff. So we'll get into the show and get started. I want to take a moment and introduce everybody. But first, I need to introduce myself. My name is Glenn Hadley. I'm the Vice President of Strategy at Dreamscape Marketing, and host of Perspective Matters this week in behavioral healthcare. Really excited to have you guys with us today. Our first guest is Joanna Conti. So Joanna created Vista Research Group to help patients get better faster during addiction treatment, and to cost effectively measure treatment outcomes. Her research team has monitored 60,000 patients during addiction treatment and followed up with more than 15,000 of them after discharge to learn how successful they've been at meeting their drug and alcohol treatment goals. Joanna also started Conquer Addiction, a nonprofit that helps families find an effective treatment and speaks nationally as a subject matter expert on outcomes. So Joanna, welcome. Thank you for joining us today.
Thank you so much, Glenn.
Right on. Cool. So our next panelist is Ben Dittman. So Ben leads the Avea Solutions team and brings in leading edge technology specific to addiction treatment, eating disorder treatment, and behavioral health facilities with the Avea Office Revenue Management Platform. He's a member of the Forbes Technology Council and also sits on the NATAP Outcomes Measurement Council. So we're really glad to have Ben here. Welcome, Ben, and thank you. Let's see here. All right, Ben, you may be muted. You might have to say hi again. I didn't hear you.
Thanks, Glenn. Appreciate it.
Cool, right on. Glad you're here. Excellent. All right, and our next panelist today is Dan Gemp. Dan is the CEO of Dreamscape Marketing, a full-service marketing agency created in the addiction treatment ecosystem. And as part of the true B2C channel in this space, he and his team help more than 120 treatment organizations with 250 plus locations in 39 states successfully navigate 2020's pandemic-related challenges and provide a pathway for thousands to get help. So welcome, Dan. Thanks for being a part of the show.
Thanks for having me, and I apologize to anybody in a high-resolution screen. My mother always said I had a face that was perfect for radio.
I love it. Thank you for joining us, face and all. We love that. All right, and our next guest is Harry Nelson. Harry is the founder of Los Angeles-based Nelson Hardiman, which is a leading legal expert on behavioral health and addiction treatment. He is the author of the book, The United States of Opioids, a prescription for liberating a nation in pain. and chairs the Behavioral Health Association of Providers, otherwise known as BHAP. Harry, thank you so much for joining us today.
Great to be with you. Excited for today's conversation.
Absolutely. Absolutely. Me too. Glad we could be here and follow up. And then finally, we have Dexter Braff, who's joining us. Dexter is the president of the Braff Group, one of the nation's leading healthcare mergers and acquisitions advisors, according to Thomas Reuters. Since its founding in 1998, the firm has completed more than 350 healthcare deals and has established itself as the leading M&A advisor in healthcare services. So welcome, Dexter. Thanks for being a part of our show.
Thanks for having us, and I'm looking forward to it. Appreciate everybody's joining us today. It's kind of cool watching where everybody's coming from. I saw there's somebody from Pittsburgh. Hi, Pittsburgh.
I love it. Well, thank you again. Thanks everybody for being a part of this and you know, being a part of this recap. I know that we put out this report earlier this year, and it's fascinating to see some of the predictions that were made and how they've actually come to fruition. And so I know that we're going to go through some of that, and you guys are going to get a chance to expand on it. But I did want to throw out the format and just let everybody know that I'm going to pick one person to kind of start the conversation in each of these with. And then if you have something to add, please add it at the end of the comments, and we'll roll from there. So, and if you're out there watching and you're just joining us, remember to put any tech support questions in the chat, and then any questions for the speakers in the Q&A, and we'll roll from there. So let's go ahead and get started. And I want to start, Joanna, I'd like to start with you, if we could. So the Centers for Disease Control and Prevention reported that an estimated 100,306 Americans died from drug overdoses during the past year. That's a record 28.5 increase from the previous year. You highlighted this trend in the original report back in the spring. Now, what are some of the trends that you and the team at Vista Research Group have witnessed throughout the second half of 2021?
Well, unfortunately, the overdose data is just getting worse, and I don't see any signs of it going to taper off. You know, it looked like we were maybe at the peak in 2018 and 2019, and then things really started climbing again when the pandemic hit. And this has been driven by the expansion of synthetic opioids across the country. They are responsible for about 60% of the overdose deaths that we're seeing now. And unfortunately, the country is just awash in them. In the first 9 months of this year, the DEA confiscated 9.5 million counterfeit pills. And when they analyzed them, 40% of those pills contained enough fentanyl or carfentanil to kill. 40% of 9.5 million pills. And so what we did last week was I got curious about the expansion of fentanyl, and some people are making predictions that, you know, the April numbers, which is the 100,000 in the past year, that is now, you know, the worst we're going to see. And so we created a little simulation of the spread of fentanyl overdose deaths across the country. And each dot represents the cumulative overdose deaths related to fentanyl since 2014 in a particular county. So Dave, if you could, this is just a 19-second video, but I want to show you, you'll see that the overdose deaths, it really started in Ohio and the Northeast and then spread. Pretty horrifying, huh?
Absolutely.
Yeah. Oh, I don't see a sign of it tapering off according to that. So I would have hoped that with such a huge increase in opioid deaths, that we would have seen an increase in patients entering addiction treatment for opioid addiction. And unfortunately, at least among the treatment centers that are part of the Vista Research Network, we're not seeing that. back in 2018, about a third of the patients in treatment were in treatment for heroin, prescription opioids, synthetics, whatever. And it has dropped from a third down to 27%, 22% last year. This year to date, it's only 19% of the patients entering treatment are in treatment for opioid abuse. But what has made up the difference is a dramatic increase in the number of patients that are entering treatment for alcohol addiction. So back in 2018, that represented about 37% of the patients. By last year, that had climbed to 50% of all patients. And this year to date, it's about 54% of the patients to date. If you want to see, I just see somebody is asking for slides. If you want to see any of this data, the original report, you can access it online at www.addictiontreatment2021.com. You can actually search by keyword, or you can download a PDF of the original report. One change, another change that the pandemic has made is it has really increased the number of patients entering addiction treatment for the first time for alcohol addiction. So the 4 years prior to 2020, I see Dan nodding, we saw about 19% of the patients at Vista Research Network members were first timers in treatment for alcohol. So it went from 19% before the pandemic to last year, it was 22%. And this year, in just the last 3 months, it's been 27% of all patients entering addiction treatment are in treatment for alcohol addiction for the very first time. So this is obviously changing, how you'll be providing treatment going forward. Another thing I wanted to talk about, changes in drugs, is with the meth drug that's out there. Over the last couple of years, the drug cartels have moved from producing meth from pseudoephedrine to a new process that is causing a high degree of psychosis in the users. And what we're finding today is about half of the patients entering addiction treatment for meth addiction have probable to severe psychosis. And this is 3 times the level we see for any other substances. So another thing to keep in mind as you plan for next year. So I want to switch and talk for a couple of minutes about outcomes. As Glenn mentioned, we've been now monitoring outcomes for over 5 years for well over 100 different treatment centers. And what we found is that there's a huge variation in treatment effectiveness among treatment centers, and realize that every single one that started using Vista came to us fully confident that we were going to find that their outcomes were better than average, right? And what we found is among this highly respected group of treatment centers, outcomes range between 18% and 50% of patients being reachable and abstinent for at least the last 30 days at 1 year post-treatment. So that's a dramatic range. And the average, however, is 36%. And interestingly, that is identical to the average found when the last similar research was done, which, believe it or not, was in 1993. So in the last 28 years, we have not seen an improvement in outcomes in abstinence-based treatment.
And that's a scary thing, Joanna, considering that what you said with the increase in fentanyl use, it's a much higher risk reward now for people that are entering into recovery, and then the increase in alcohol use as well. It's more important for us to be more effective with these patients, correct?
Absolutely. It's critical. It's life and death. You know, it's always been life and death for a portion. It's even more when one pill kills. You know, you can't afford relapses. with today's drugs out there. So the one positive note I'll say is that we have seen outcomes improve among one group. And that's the group of treatment centers that are measuring their outcomes. Because Peter Drucker was right. What gets measured gets managed. And what we found is among treatment centers that are measuring their outcomes for multiple years, 20% more patients are in recovery 6 months post-treatment, the second year that a treatment center is doing outcomes on average versus the first. So as Glenn mentioned, a year ago, my daughter and I started a nonprofit, Conquer Addiction, to help families find the treatment centers with the most effective outcomes, most effective treatment. You don't have to use Vista or any other particular research company to be on Conquer Addiction. What you do have to do is comply with the guidelines set by Conquer Addiction's independent panel of judges. And when you submit your results, you can submit them, when you're ready to brag about them, and then you'll be ready to promote them to the patients and the payers who are really starting to demand real verified outcomes. So
wonderful. Thank you for that, John. I really appreciate that. And it really does highlight the not only the danger out there and increased danger, but also the need to track our efficacy and how well we're doing what we do.
right. This is healthcare. We're providing healthcare. We need to treat it like healthcare.
100%. I definitely agree. So let's and feel free to jump in there anywhere, guys. If there's anything else that anyone wanted to add on the.
This is I'd just like to add two points on kind of the state of the crisis that I think people should be aware of. One is that when Joanna's talking about the skyrocketing overdose death rates, one of the things that's come out is that pain prescribing is down significantly, over 70% down over the last 5 to 10 years, which means that we can no longer say that this crisis is either doctor-driven or, frankly, pharmaceutical driven, which really forces us to ask to reevaluate what's going on and to not be distracted by the opioid litigation in terms of thinking about what the real drivers are. And the other thing is, I think we are only beginning to understand just how badly the pandemic has exacerbated the situation on the ground in terms of isolation and trauma. So I think that I'm in the middle of writing a book that's going to come out next spring on the overdose issue with a group in Florida. But I think we're going to see, we're fully expecting an acceleration of not an improvement in the numbers.
And, one of the things that's interesting, and I hate to put a spin on this that's financial, but there's a reality here. And that's that the pandemic has been responsible for a remarkable increase in investment in all behavioral health services. We've seen an extraordinary amount of new dollars coming into the space as the market has realized. We were already in a situation where people were realizing how much need there was for all types of behavioral health interventions, particularly on the addictions treatment side. But the COVID has focused a lot of thinking on expectations for the future, and the increase in the deaths that Joanna pointed out are a very stark reality that there's a tremendous demand for increased utilization and access. And while that's excellent for patients to access services, and we need more of it, as you can imagine, the investment community has looked at that and they've said, gee, we need to get on board on that. So there's been a real financial implication for those people that are out there that are in the marketplace. It's an unfortunate byproduct of it, but that's the nature of healthcare business.
It's interesting to hear as well that, you're hearing an attorney tell you, don't pay attention to the litigation on this. It's not solving the problem, right? And hearing, mergers and acquisitions experts saying like, private equity is throwing money at this problem, right? It's so off the charts, you can't pretend not to see it. And Joanna's actually been talking to us for years. Groups that market their outcomes, even if you think your numbers aren't great, even if your own numbers haven't improved since 1993, it's not like anyone else's did so much dramatically better. And so it adds transparency in your marketing. Family members trust it. And in digital marketing, we've seen conversion rates go up by 10, 20, 30% from sharing something as simple as what percentage of patients just complete the recommended course of treatment at your treatment center. Simple data. So
Absolutely.
a lot to think about there.
I think it's interesting that we have all of these different perspectives coming together, pointing towards the problem and how we can work out of it, no matter what side you're looking at it. And it kind of segues me in my next point of coming together is that Ben, I want to chat with you a little bit. That earlier this year you talked about the payers and providers coming together for the first time, I think in many cases, to address the needs of patients trying to get help or access care during the global pandemic, especially when it comes to telehealth and those kinds of things. So what have you seen with that? Has there been any more expansion on that or decline in that since the report was put out?
Yeah, so it's really kind of twofold. So we saw a lot more communication around telehealth, getting access to care. There's continued talks around value-based reimbursement, but this kind of goes off of everything that Joanna's been talking about in order to really understand the value and be able to sit at the table with the payers and negotiate value-based reimbursement contracts. You have to understand the outcomes and the impact that you're making. And so I think we're going to start to see more and more communication across the line with the payers, but it's still not to the point. We don't have enough of the data to tell the story. You know, we're providing services from a clinical standpoint that often don't match claims data. So a good example for that is a treatment center will be authorized 5 days of detox, but the patient needs 6. Rather than fighting for that additional day with the insurance company, what they'll do is they'll bill a residential day, and then it takes 1 day off of the residential days. And so what you're seeing is a different set of data that's going to the insurance payers rather than what's actually being provided. And so it's shrinking those number of authorized days. And we need to, I mean, from a cooperation standpoint, as an industry, get better at data reporting. I see a lot of neat things happening though. I see what we're doing with National Association of Addiction Treatment Providers, 4C project or FORCE project, the collaboration between different technology partners. So you've got Kipu on there, which we're now part of the Kipu family. You've got
Congratulations on that, by the way. That's good stuff. Speaking of coming together, I think that it makes a lot of sense and really to provide that accurate data instead of what we do see where I think the payers have one set of data that they're going off of and they're making decisions based on, and they're like, but this works at this level of care, but they're not getting all the data, right?
Yeah. So we're really excited to be part of the Kipu family and the investment that they're putting back into this industry and our technology. But the other side of that is the ethos has changed. It's open and integrated. You know, we want to be sharing data. Avea Solutions on the billing side, we work with Aliva, we work with other billing companies, work with multiple outcome measurement tools. We at the end of the day really need to have an understanding of what's going on within the industry. So I think cooperation, as you mentioned, is huge. And then there's new technologies that are coming out too that I think will be interesting over the next couple of years around, you know, artificial intelligence, how to increase clinical documentation, you know, some of the we've seen AI and video tools that can help actually patient engagement. So all of that will actually play into, you know, how we respond to this within the industry and pull the data together.
Right on. Does anybody else have anything to add on that?
Yeah, you know, we've seen the government helped out a little bit here, and so did the payers. There's a lot of folks relaxed their requirements on getting paid for telehealth services because the demand for those options as a result of COVID. It's another thing that COVID has brought forward that has had a significant change on the way that we do business. Ben, one of the things you mentioned, because I thought was really interesting, is we see a company where there's a nexus between the opportunities available with telehealth, a provider and a payer. There's a group out in Connecticut that's got involved in developing a home-based addictions program, which they have pretty robust outcomes figures, as Joanna was talking about. And they rely a lot on all different types of remote monitoring and telehealth services. And their whole raison d'etre is to partner with payers in order to provide these services. So you've got this triangle of a payer, a provider, a telehealth opportunity, all coming together, which probably might not have gotten as much acceptance without having COVID forcing the hand of providers, and also having to rely on new ways of providing services. So very interesting that we've seen. It'll also be interesting to see whether or not payers will continue to take a position where they'll be open to keeping some of the relaxed standards on deployment of telehealth because of how successful it's been.
Yeah, what do you see happening there, Ben?
On the telehealth side, so it's interesting. Paul Joyner, the new CEO of Kipu, was recently at a meeting with the CEO of Humana and Florida Blue and others, and the number one topic was telehealth. You know, they see it as part of the continuum of care. How they continue to authorize and support it is a whole nother question, but it is here to stay. And it's, you know, what's amazing is in healthcare years, telehealth moved forward about 7 years and about 2 weeks when COVID started.
Right.
It was just amazing to see. And if we could get that type of engagement in the industry to fight this, fight this disease and everything that's happening, it's too bad we don't have some of these. Sometimes you need a big shift in order to make huge changes. So.
I can just add a couple comments on this. I included in the chat a link to a McKinsey report that came out in July that I encourage people to look at. It shows that originally telehealth adoption generally went up 80 times. It stabilized at just below 40 times pre-pandemic usage. What's super interesting for this conversation is there's a graphic in there about where adoption happened the most, and behavioral health and substance use disorder treatment are far outpacing everything else, every other modality of care on telehealth adoption. And so what we're seeing is that in the pandemic, in the public health emergency, all of the, Medicare and the, loosened up all the requirements. There was a comment in the chat about, can you do medication assisted treatment monitoring and how do you do it? And what I was going to comment is that the public health emergency liberalization is not showing any signs of going away in 2022. And just the opposite, we're seeing active discussions in Medicare about sustaining some of the liberalization, big questions around what's going to happen to the Ryan Hate Act. And I think this is really a ground shift that every addiction treatment provider should be thinking about how they relate to this just massive change that's happened.
Yeah, plus Harry, if you put tele in front of your company's name, your valuation goes up by 50%.
Oh, goodness. One of the things we found that's in the State of Addiction Treatment report was as we showed how quickly treatment centers were moving to telehealth and what impact that had on patient satisfaction. And what we found was that, 6 months, 9 months, a year later, that the highest satisfaction was among patients that had received both face-to-face and telehealth treatment. It was a little bit higher than those that had gotten just face-to-face. Interestingly, just plain telehealth was lower, but this was data from 9 months ago. And so, that may have changed as consumers have gotten even more comfortable with it. But clearly the combination of face-to-face and the convenience of telehealth was really appreciated.
I do think that this conversation was definitely, it was expedited by the COVID-19 pandemic. And before this, we were talking about telehealth being used in remote communities where access was limited. And now with this being readily accessible, what I'm seeing out there is that the number of younger patients having more access, college students specifically having access to behavioral health services unlike ever before, because it's a medium that they're very familiar with. And so to move from that and talking about the patients, Dan, getting to your report, digital marketing in behavioral healthcare tends to be the true B2C channel to the consumer in this space. People don't just go asking their neighbors where they sent their loved one to treatment. That doesn't happen often, right? They tend to go through digital marketing efforts. And so I know that you highlighted that more people were reaching out, going through to find these services during the pandemic. What are you seeing now? What's that looking like?
Yeah, so first of all, you guys are all smart. It's interesting what we saw from earlier in the year until now, which trends are coming true. But I think what's important for everyone attending today to realize is these aren't our opinions. These aren't predictions we're making. We're looking at years worth of data and just kind of putting a ruler through that data and trying to project what comes next. So for those of you that are geeking out on data, the telehealth trajectory is an inverse tangent yield curve, okay?
Whoa, baby.
Just like the return on investment model from organic search engine optimization, right? It starts off steady. There was low adoption, then there was massive exponential adoption, but it will hit a peak eventually because there are only a fixed number of human beings, right? And we went from something like 7% market saturation at the end of 2019 to about 97% of us having had telehealth appointments this year, okay? So it will grow, patients are comfortable with it, but it doesn't fit all needs. I've seen chats in here about, how do you monitor MAT? You can't through telehealth, right? So there are certain models that require in-person therapy. The fact that what we're really marketing here is a therapeutic alliance, it's tough to generate trust through a screen when you're not necessarily even seeing the same psychiatrist appointment to appointment. So keep that in mind that there are conditions and initial diagnoses, such as skyrocketing first-time alcohol diagnoses, that are easy to make through telehealth, and it's the right product for that. But not all long-term care, abstinence-based care, and not all of this can be done through that platform. We're also starting to get phone calls for the digital marketing to recruit because telehealth companies are fresh out of professionals to provide treatment, right? So it's become ultra competitive to find nurses, psychiatrists, physicians at all levels in all medical sectors. So telehealth has its own set of advantages, and adding that word tele has direct value, right? But it also has a limit. We're far from it, but it will have a limit and a right fit and purpose for this industry. So keep your eyes on it. Maybe take a look at how it applies to your aftercare models or tracking your outcomes or your alumni. But it's a great way to keep in touch and provide meeting venues when society was in lockdown, right? So what the data is showing us now on the digital marketing side, right, where technology meets the message we're broadcasting, right? People want dialogue right now. We are not looking for our computers to tell us what to do. We're asking our computers questions, expecting answers, and asking follow-up questions. So we are engaging in dialogue with our computers in the weirdest way ever. To talk about weirdest things, right? In the original paper, I referenced the Tiger King conundrum. It's the weirdest show about a tiger trainer turned meth addict who's in prison. But there are now new episodes available for Tiger King, right, as of a week or two ago. So many millions of people watched so much streaming media at the start of COVID. We all watched all of Netflix, right? It's been digested. And so that amount of time per day that we've been spending in the new remote work environment, right, hasn't changed. We're at an all-time high level in all of human history of digital content digestion, right? We're consuming 7.5 to 8 hours of digital media daily on average. What other time is there in a day? You're either sleeping, working, or streaming, right? So it's gotten truly crazy. And you need to realize that 86% of patients seeking residential treatment make their decision through Google. No other search engine, no other channel, right? So the number one source of medical expertise in the world is Google. So we're looking at this record year of overdose deaths, mass adoption of telehealth. What's coming next, right? What is the data showing us in a crystal ball? Well, the Google algorithm changed in April pretty dramatically because they have to stay ahead of mankind and give us the answers we want, right? So your core web vitals, how quickly your website loads, right? Your user experience, how the content loads on the homepage of your website, right? There are about a dozen new variables you need to be paying attention to in order to rank the best on the Google machine, right? Load speed matters more than it did 2 years ago because we all want immediate answers. Full screen device usage is skyrocketing and no one paid attention to it, but we saw that the conversion rates to our Google pay-per-click ads went way, way, way up on full screen desktop devices. Oh, because well-insured people seeking a diagnosis or help for their first time alcohol diagnosis, right? They're turning to their computer because they're working remote, they're at home on a full screen device. So people did not readjust their ad dollars and they missed the boat by about 37%. And we've seen a direct cost per admission correlation to that, okay? So if you've seen your cost per admit go up as much as 37%, that's why, that device trend, okay? Content generated ads. Google has AI working for it now, so it doesn't have to have as many humans working for it now. And it'll read the content of your website and create an ad automatically for you. That AI then reads the ad and serves other relevant ads to you, right? So this is all predictive modeling and the beginning of AI. And so understanding what you mean, if you have a page called heroin rehab, Google now knows all of the synonyms. It will find all related ads. It knows opiates, opioids, and heroin are the same thing, right? It knows fentanyl and carfentanil are different things, but the same thing. And so your content, this is an adjustment in your content strategy. It can't be surface level anymore. You need a subject matter depth using synonyms and variations of terms so that Google can read it and serve up synonymous terms. You need a relevancy. So if you're producing a page about heroin, you might also need to produce a page about fentanyl and the confiscation of 9 million, illegitimate pills and things like that. And the best way to deliver that to Google, it used to see every page on the internet as equal, but now there's a hierarchy that it's trying to teach its robots, right? Your top 10 performing pages are what you would call pillar pages, and you need to support them with your less important pages, your blog articles, and these other content clusters of related information. So you will need to re-architect, if you haven't done it, you will need to re-architect your website itself to meet these core web vitals, and your future plan for content. And again, this should be one of your primary sources of admissions, right? That content structure does need to evolve as well. On the PPC side, we're seeing some pretty crazy trends, but what's coming next is what you need to be ready for, right? So the desktop streaming prediction we made earlier in the year, that came true. What we're seeing next is Google is trying to automate more of its paid search ads. It will automatically create the title and description and tagline in your ads based on what your website says you do, right? And it's to cut down on irrelevant or false advertising kind of messages, right? If you're not a detox and you're running ads for detox, that's a big no-no. So those that are not prepared for this, some of these changes are being deployed in January of 2022. And so your paid search approach, this is one of the most competitive industries in all of healthcare. It is the most expensive on Google pay-per-click ads in all of healthcare. If you're not prepared for it, right, Dexter will tell you how that impacts your valuation. So what's coming next, and is we're seeing, I told a few people in chat, we'll address other models and then I'll shut up for a moment. But the expansion we've seen this year isn't just private equity money coming in and doing consolidation and adding new levels of care. MAT is a new model. And 2-3 years ago, the big debate that we would have been talking about in this trend is abstinence-based care and the stigma related to MAT. You're telling me the solution to heroin is more heroin? You're crazy, right? And so what we've been seeing is massive expansion and public adoption of MAT, right? It also provided a hyperlocal option during COVID, so people could get MAT treatment when they couldn't necessarily travel for care. And then more recently, we've seen this overlap. Telehealth is being adopted, as is MAT. And so there are new types of indirect competition for your marketing to keep an eye on. Here's what's coming next. So prepare for this. More indirect competition. Psychedelics. It is happening, whether you agree with it or not. You're going to see thousands of clinical locations open up, and they'll be providing not just ketamine, they're going to be providing an expanded set of approved substances, right? You're going to see psilocybin, right? The key ingredient in magic mushrooms. You're going to see MDMA, ecstasy, delivered as controlled medication, right? And I would not be surprised long-term, right? Heard this from a trusted source. If you see CBD somehow categorized in any regulation related to psychedelics. And that will be a really interesting approach to regulated therapy using CBD. So this concept of, oh, you're addicted to pills, we have a pill for that. It sounds crazy to those of us in the industry, right? But that is what Americans shop for. We want a pill that fixes what ails us, right? From ibuprofen on down. And we've seen a shift, one last key trend in the supply chain of illicit substances. It was much harder to get good old fashioned heroin, right? From border states and Chicago distribution centers and East Coast port cities like Boston and Baltimore. And we saw this massive rise in stimulants, right? 13 to 17% increases state by state in meth and cocaine. And we're seeing massive mental health primary diagnosis for the first time, alcohol diagnosis for the first time. So this pandemic is not yet at its peak in terms of what it did to us, right? We're still on the way up. You're going to see more and more overdose, more and more admissions. And so this is a growth industry right now, but you might want to keep an eye on your marketing on that supply chain of illicit substance, on that map that Joanna provided in overdoses, right? It almost directly mimics the supply chain of illicit substances and the ability to get drugs to market. So think like the cartel in your digital marketing.
Yeah, and Dan, I want to jump in and just say that just like the ever-changing ways that we are opening up the doorways to recovery using different forms of MAT, psychedelics coming into play, it is changing drastically, and a lot of that has to do with the changing regulations out there and new studies on these different methods. And so I do want to shift gears for a second and talk about some of the changing policies that are opening up these new doorways. And I think the only thing is changing faster than the ways to treat addiction are the legislation around it. So Harry, I'm going to turn this over to you. And Marcus put a question in there: what federal and state legislation will drive funding and treatment response most strongly in 2022 and 23? I think that's best handled by you. What do you think?
Yeah, no, it's a big issue. I was looking to see, I've been trying to use the chat efficiently to get more in the conversation. There was a major allocation for SAMHSA grants, for recovery. We're seeing recovery services at all ages, and recovery housing in there. California has been as we've seen, the blue states have been moving much more aggressively at the state level. Enormous amounts of funding, both for new kinds of behavioral health treatment and recovery services, recovery housing. So we're seeing that trend around the country. I'm happy after this call to try to put a few of the best examples, and we've got to get that moving faster in the states where it's already been agreed to, like California. The money's been agreed to. We're not seeing it disseminated down yet, distributed out. And we've got to get the authorization in the states that are not moving as quickly.
Right on. Let me see. I did want to read. There were some questions on here about. There's someone that was asking, and I think this kind of goes for everyone. Joanna said SUD is healthcare and should be seen as one. What do you think the state of our agencies to provide the same level and quality of care compared to primary care? And Harry, what are you seeing on the policy level? Because you talked earlier in the report about parity, especially, and being on the same level as physical health care. What are you seeing with that?
So I would say, I made a comment in the chat, but I would break it. There's I see 4 stages of parity. we had the original federal mental health parity and a lot of progress in the states to just have addiction treatment and behavioral health treated the same as medical surgical care. That was sort of the beginning of parity. The next step, by the way, with things like telehealth and also just expanding the kinds of behavioral health conditions that are covered has been a second stage. The third stage, where we are right now, is only happened in about 10 to 12 states, is what I would call payer parity. And that's what I put an example of AB 744 in California in the chat, very representative of what we're seeing, payers essentially being required to cover in-network. By the way, not forcing federal programs. So you see a lot of variants and Medicaid, but it covers those state parity laws are forcing in-network payment at the same levels. The next step ahead is to get more protection for out-of-network, and that's going to be a massive fight that's ahead of us over the next decade.
Right on. Thank you for that information, and we definitely see that. And in talking about the funding, I do want to make a quick jump and Dexter, earlier this year in the report, and actually whenever I heard you speak in Chicago, you spoke about the added pressure on these private equity sponsors to deploy capital due to the pandemic and that freeze that took place, and they have the funds available and they need to spend it now. So where are you seeing that being deployed so far? Yeah,
so it was interesting because going in 2020, as soon as the pandemic hit in March, M&A activity and investor activity, essentially went to nothing, but very, very low. It was the lowest period of output that we'd ever seen. And the projection was that all of 2020 was going to be a really down year. If you ask a typical private equity guy how 2020 was, they'll tell you it was a bad year, it was a down year because of COVID. What's interesting is that the numbers actually don't bear that out. What happened is that in the fourth quarter of 2020, there was a massive amount of activity. And so when you actually look at 2020 compared to the prior years, although 2019 was a record-breaking year, 2020 was just slightly below where 2019 was because of the remarkable amount of catch-up that happened in the fourth quarter. But that perceived hunger for deals and the sense that we need to make up for a lost period of time carried into 2021. And so we are already seeing record-breaking activity across all spaces, healthcare and non-healthcare, for private equity, as transaction volume has soared, transaction dollars being spent has soared, valuations have soared. So across all spaces, we've seen an extraordinary increase in activity. You add to that the fact that a lot of sellers, would-be sellers, are tried to sell and are going to try and complete deals before the end of the year, because with the election of President Biden, his early tax plan called for a doubling of capital gains tax, which would really have eaten into the net proceeds that sellers would wind up getting. And so a lot of sellers took the attitude that if there's going to be a change in the tax laws, they wouldn't be effective until 2022. So a lot of folks use 2021 to accelerate their divestiture plans. And so all of that has come together to produce record-breaking activity. And we've seen the same type of activity happen on the behavioral health side and in the addiction side. And when you add in the things that we talked about earlier as it relates to how COVID has focused our attention on the needs for mental health interventions, you've got this aggregation of activity that has come together to create what is arguably the most robust period of M&A activity that we have seen, not only in healthcare services, but particularly in the behavioral health space, a development that we fully expect is going to carry well into 2022 and beyond. The wind behind behavioral health M&A is something that's going to be highly sustainable over the next several years, because of not only the things that we just talked about, but also because of the demand for services. So right now, if we annualize the amount of deals that we've seen through the end of the third quarter, and we actually think that the numbers in the fourth quarter will be higher because of people trying to get their deals done by the end of the fourth quarter. We're looking at a record-breaking year in addictions treatment M&A to the tune of about a 15 to 20% increase over the record that had been set in 2018. We expect that to continue in 2022. And also the other thing that we saw is that we have been talking for many years about the expectation of movement from high cost residential programs to lower cost outpatient programs. And frankly, we didn't see the level of adoption that we had anticipated over a 5-year period of time. While we did see increases in outpatient transaction volume, the amount of activity within that space was still relatively small until 2021. We're now beginning to see a very significant movement of investment in that area, probably spurred by the adoption of telehealth services and the realization that the residential setting is not necessarily the best setting. And we've also seen that in the mental health side with consolidation in clinics. So outpatient services, PHP, IOP, mental health counseling is likely to be the area where we're going to see the greatest amount of growth in addictions M&A over the next 3 or 4 years, although the residential side has still been strong. Where we've seen the greatest amount of growth is in the public sector funded residential programs. A lot of that because of the increased amount of money being made available for that, and the demand for services from people that can't afford the $50,000 a month programs that you might see in California, Florida, and in Arizona. So remarkable changes happening nationwide across all private equity and M&A, and how that has trickled down into the behavioral side and the unique aspects of what we see in behavioral has made for just a very, very interesting, dynamic, shifting environment that if you're a seller, the times couldn't be better. If you're a buyer, you're taking a lot of deep breaths in terms of the amount of value, the amount of dollars necessary in order to land some of the best and most attractive properties.
Absolutely. And speaking of volatility, as I'm looking over, I'm really excited to see what's taking place in the chat. I'm really, it's good to see the interaction that's going on in there. And it just shows that people are hungry. They're hungry to learn. They're hungry to grow. They're hungry to do things the right way. I'm really excited to see that. I have time for a couple of questions here, and I want to throw this out to the group and go through this. But I'm going to ask the panelists, if you guys don't mind, as we're going through these last questions here, if y'all can put any contact information or how the audience can get in touch with you to reach out after this is over. To ask very specific questions. Some of these we just can't get to in a forum like this. And so please look in the chat to how you can contact the panelists on their own. And please continue the conversation. The more conversations like this we have, the better we can further this industry and help more people. So I do want to ask Marcus had a question around how do treatment providers ensure that they have technology solutions to meet reporting and regulatory requirements that meet new reimbursement initiatives? That's a big question. And so I'm going to throw that out there. We're talking about technology solutions and how they relate to reimbursement initiatives.
So I mean, this would be something that I'd want a little bit more context from Marcus regarding. So I'd actually say, Marcus, if you want to reach out to me directly, I put my contact information in the chat area because I want to make sure I'm answering everything properly. Part of it is it depends on where you are, what you're doing, what technology solutions you have in place today. So is it on the clinical side or the billing side? But yeah, reach out to me on that. One thing I'd also like to mention, Glenn, is I know that a lot of us will be attending TCIV, and one of my favorite conferences of the year is coming up. Dexter's been giving a presentation for, what is it 5 years or 6 years in a row? And it's always been a highlight for me to really get an insight on where the industry's going and see the predictions. And so you got a small glimpse of it, of what he was going to say today, but he does an entire presentation. If you are attending TCIV, reach out to all of us. We'd love to meet up, have a coffee, talk in person. And then Dan has an incredible, always incredible marketing, but probably the most entertaining presentation at the event as well. So
I'm just glad that none of you guys let off with "I told you so," since we're talking about your own predictions here.
Absolutely. I do want to ask this one, and this one, Harry, would probably be more geared towards you. There's a person, a particular individual in LA that's looking for how they find the most recent telehealth regulations. Finding these as they always change is a challenge in itself.
Do you want me to answer that, Harry, or do you think you have it
Yeah,
covered?
no, you can go ahead. Yeah, I'm happy to turn it over. Oh, do you want me to answer it? Sorry.
I'm not.
Sorry, I misunderstood the question. So in terms of commercial payers, you want to look at AB 744, which is the state of the law, which I've been referencing. The other place to look is on the Department of Healthcare Services website for Medi-Cal changes on telehealth, which have been significant. But I put my email in, and if anybody wants the specific links, I'm happy to send them over after the webinar today.
Wonderful. Thank you for that. And I was just saying, does anybody have any closing thoughts? We have a couple of minutes left, and I'd like to give anybody that had something that came up during the discussion that they want to finish off with, and before we close.
Sure, I'll add something. We've had a little bit of discussion about medication-assisted treatment. And one of the continuing holes that I see is that while there's a lot of data that shows that while patients are taking their medication, that death rates go down, but there hasn't been data that has followed up with the patients who discharge from treatment, early on, what happens to them. And so Conquer Addiction, we've created a research institute and have raised $250,000 in funding to do post-treatment outcomes research for medication-assisted treatment centers, so that eventually we will have hopefully comparable data, post-treatment and during treatment outcomes data for medication-assisted treatment and for abstinence-based treatment. And because we've raised that funding, there's some opportunities. We're looking for 2 really effective medication-assisted treatment centers that would be interested in getting post-treatment outcomes research for their center, and it would roll into the entire knowledge that the industry will have moving forward. So eventually, our goal is to be able to say, you have somebody with this drug use history, maybe this demographic profile, they are more likely to be alive and thriving a year from now if they use this treatment modality or that treatment modality. So that's what we're working on long term. Obviously, we're several years away from there, but I put my information in also if you're interested in being part of a study like that. Again, your data itself will be confidential. It will just be aggregated with that from other treatment centers. So please reach out to me if you're interested.
Wonderful. And that goes for everybody that's on this panel. The contact information is in the chat. Please reach out. Please continue the conversation. Please continue this at TCIV. Come see us. And I mean, with this, I'm definitely looking forward to the 2022 State of Addiction Treatment report that I'm sure will be coming out next year. I'm excited to see what that looks like. So with that, we'll go ahead and close the show today. Thanks everyone for being a part of this and for bringing your wealth of knowledge to the show and helping educate the audience. We really look forward to doing this again. Thank you guys.
Thank you all.
Thanks, everybody. Thank you for coming.
Thank you. Thanks so much, Glenn. Thanks, everyone.
Cheers. Bye, guys.